What if the habits quietly stealing your eyesight have nothing to do with your phone or your television, and everything to do with things you do without even thinking 5 times a day? You've probably lectured your grandkids about screen time, but the real threats to your vision are hiding in plain sight in your own daily routine. And one of them is already responsible for roughly 10% of the 15 million cataract related blindness cases on this planet. Stick with me, because by the end of this video, you'll know exactly which of your habits are putting your sight at risk and what to do about it starting today. I'm Sam Waterling, and for the past 15 years, I've watched these exact habits show up again and again in real patients sitting across from me. Not rare cases, not unusual stories. The same 5 things over and over in people who had no idea their own routine was working against them. Here's something most people never hear in a rushed office visit. Keeping you healthy doesn't pay the bills the way treating you does. Nobody's rushing to hand you a 5-minute checklist that keeps you out of the exam chair for good. So if you want the version of EyeHealth nobody's incentivized to tell you, stay right here. Because by the time we get to habit number 5, you'll understand exactly why so many people lose vision they never had to lose. And if this helps you, hit subscribe and like the video. I'm trying to get this channel to 300,000 people who care about seeing clearly for the rest of their lives. Let's start with something so ordinary, you've probably done it today without a second thought. Rubbing your eyes. An itch hits, you rub, and it feels harmless, right? Almost everyone does it. But pause for a second and think about what your fingers touched in the last hour. A doorknob, your phone screen, cash, a keyboard. None of that is clean. And every time you rub, you're grinding whatever's living on your fingertips directly into one of the most sensitive tissues on your body. That's exactly how bacterial conjunctivitis takes hold, an infection of the thin membrane covering the white of your eye and the inner eyelid. Redness, discharge, days of misery, all from a habit that felt completely automatic. And if your eye has recently had surgery or sustained any kind of injury, rubbing it is like pressing on a wound that hasn't closed yet, practically inviting infection straight in. But here's the part that almost never comes up in conversation. Research published in the journal Cornea and in the Journal of Cataract and Refractive Surgery has linked chronic repeated eye rubbing to a condition called keratoconus. Picture the cornea, that clear curved surface at the very front of your eye, as a windshield. Keratoconus is what happens when that windshield slowly weakens, thins out, and starts warping into a cone shape instead of staying smooth and round. Your vision blurs, distorts, and in severe cases, it can progress all the way to blindness. And if you already have early keratoconus, even a form so mild it hasn't caused a single symptom yet, constant rubbing will push it toward full-blown disease in nearly every case. Something as small and mindless as an itchy eye rub can end up costing you the clear window you see the world through. This matters most with children because they rub their eyes constantly and almost nobody stops them. Watch your own hands and watch theirs even closer. If the child's eyes are itchy, don't just let them dig in day after day. Figure out why. Allergies, an infection, something else? Treat the actual cause instead of letting the habit run wild. I'm not saying never touch your eyes. I'm saying a chronic rubbing habit is where the real danger begins. Which brings us to something you may be getting completely wrong: sunglasses. Consider this. Roughly 15 million people worldwide are blind from cataracts, and about 10% of those cases trace directly back to years of unprotected ultraviolet exposure. A cataract is simply a clouding of the lens inside your eye, the part that's supposed to stay perfectly clear so light can pass through and focus properly. So sunglasses aren't a style choice, they're medical equipment. Your natural lens filters out some light, but a portion of ultraviolet radiation still slips through to your retina, the light-sensitive layer lining the back of your eye. And that radiation is genuinely toxic, both to your lens and to the delicate cells that give you sight in the first place. Left unchecked, ultraviolet exposure doesn't stop at cataracts. It also targets the macula, the small central patch of your retina responsible for your sharpest, most detailed vision. And that damage leads to age-related macular degeneration, a slow, silent erosion of your central sight. Here's where most people get tripped up. Choosing the wrong sunglasses can actually make things worse. Look specifically for a label that says UV 400 or 100% UV protection, confirming the lenses genuinely block that harmful range of light. Cheap sunglasses from a street stand often just darken your view, which tricks your pupil, the dark opening at the center of your eye, into widening to let in more light. Now you're flooding your eye with even more ultraviolet radiation than if you'd worn no sunglasses at all. Quality sunglasses also protect the delicate skin around your eyes and eyelids from that same damage, skin that's thinner and more vulnerable than almost anywhere else on your body. I've had patients come in with skin cancers on the eyelid itself, something most people never think to worry about until it's already there. And don't assume this only matters on a blazing summer afternoon. Some of the highest exposure happens up in the mountains on a clear, snowy day, when sunlight bounces back up at your eyes from every direction off the white ground. That's exactly why serious mountaineers wear those oversized wraparound glasses that curve around the sides of the face. It's not a fashion statement, it's full coverage. Choose frames with large lenses that sit close to your face and you protect the entire eye, not just what's directly in front of it. Now, habit number 3, contact lenses. Millions of people wear them safely for years, and most know the golden rule: never sleep in them. Yet you'd be amazed how often that rule gets broken. So, what actually happens when you fall asleep with your contacts still in? A contact lens sits on your eye like a barrier, partially blocking the oxygen and nutrients your cornea needs to survive. And your cornea has no blood vessels of its own. It depends entirely on your tears and the surrounding air for everything it needs. Add a lens on top, even a high oxygen permeable one, and some of that airflow still gets cut off. Your cornea begins to suffocate, a condition doctors call hypoxia. Now close your eyelid over that for 8 straight hours of sleep, and the suffocation gets dramatically worse. Starved of oxygen, the cornea fights back by growing new blood vessels where none should exist. And because your tears aren't flushing the surface clean anymore, ordinary microbes that live harmlessly on your eye can suddenly turn dangerous, triggering conjunctivitis at best or keratitis, a serious inflammation of the cornea at worst. A 2021 study published in the journal Eye and Contact Lens found that people who slept in their contacts faced a keratitis risk 6 to 8 times higher than those who removed them before bed. And in that same study, nearly a third of participants admitted to sleeping in their lenses regularly, essentially gambling with an eye infection every single night. I once treated a man in his 50s, active, healthy, careful about most things, who fell asleep in his lenses maybe once or twice a week after long shifts at work. He never thought much of it until he woke up one morning with a painful, cloudy, light-sensitive eye. By the time he came in, he had a corneal ulcer already forming, and what should have been a routine contact lens fitting turned into weeks of antibiotic drops and a permanent faint scar on his cornea. He told me afterward he had no idea a habit that small could do that much damage. That's the story I think of every time someone tells me sleeping in their contacts once in a while can't possibly matter. So here's the fix. If you wear daily disposables, use them for one day and toss them, no exceptions. If you wear planned replacement lenses, respect the replacement schedule, store them in fresh solution, and check the expiration date on that solution too. And never, under any circumstances, swim or shower with your contacts in. Water carries risk, and if the wrong microorganism gets trapped underneath your lens, you could end up with acanthamoeba keratitis, a severe infection that in the worst cases leads to total vision loss and the need for a corneal transplant. Parents, this one deserves your attention too, because even a mature teenager doesn't always understand what's at stake. Habit number 4 is the one dripping with irony. We spend so much energy warning kids about their screens, then model something far more destructive ourselves: smoking. You already know it causes lung cancer. What you may not know is exactly how aggressively it targets your eyes. Here are 4 eye conditions smoking directly fuels. First, age-related macular degeneration. A British Journal of Ophthalmology analysis covering 40,000 patients found smokers face roughly 2 to 3 times the risk of developing it. And here's the painful part. That elevated risk doesn't fully drop back down until 15 to 20 years after quitting. Second, cataracts. Cigarette smoke is packed with oxidants and microscopic particles that damage and cloud your lens years earlier than it would naturally cloud on its own. Third, glaucoma, a disease that gradually destroys the optic nerve, the cable carrying visual signals from your eye to your brain. We tend to think of glaucoma as something that only affects the elderly, but smoking can trigger it far earlier by restricting blood flow to the optic nerve and raising pressure inside the eye. And once glaucoma sets in, it never fully leaves, which makes eliminating triggers like smoking absolutely essential. Fourth, diabetic retinopathy. If you're living with diabetes, particularly if it's poorly managed, retinal damage is likely coming eventually. Add smoking to that equation, and the damage arrives sooner, progresses faster, and does more permanent harm. Your eye is one of the most densely vascular structures in your entire body, packed with delicate blood vessels, and smoking causes those vessels to constrict and spasm, punishing everything from your lens to your retina to your optic nerve. The fifth habit is the quietest and maybe the most dangerous of all, avoiding the eye doctor for years at a time. You think, my vision's fine, nothing hurts, I read and drive with no problem, why bother? But an eye doctor's job goes far beyond writing a glasses prescription. Modern eye exams use technology that can examine your eye down to the microscopic level in just a few minutes, often catching disease long before you'd ever notice a single symptom. That early detection changes everything, with conditions like macular degeneration, glaucoma, and cataracts. It's infinitely better to catch a problem early and stabilize it than to meet it at a stage where there's nothing left to save. Consider this from the American Academy of Ophthalmology. An estimated 40 to 50% of people living with glaucoma have no idea they have it. We can't cure glaucoma. We can only halt its progress, which means the stage at which it's caught determines exactly how much vision you keep for the rest of your life. I think of a patient, a retired teacher in her early 60s, who came in only because her daughter nagged her into it. She had 20/20 vision, felt completely fine, hadn't had an exam in almost 9 years. We found early stage glaucoma that hadn't touched her central vision yet, only the far edges she'd never have noticed missing until it was too late to get back. Because we caught it then, medicated eye drops were enough to stop it in its tracks. Had she waited even another 2 or 3 years, we might have been managing permanent, irreversible vision loss instead of simply keeping a number in check. That's the entire argument for regular exams in one story. The diseases that steal the most vision are, almost without exception, the ones that don't hurt, don't blur your sight early on, and don't announce themselves until real damage is already done. And your risk for all of this rises with every passing decade, along with how symptoms present and how your body responds to treatment. So tell me, how old are you? Drop it in the comments below. I genuinely want to know which age group makes up most of this audience, because it shapes exactly what content will serve you best going forward. So here's your action list starting today. Stop grinding at your eyes, and when they itch, track down the real cause instead of rubbing it away. Invest in real sunglasses labeled UV 400 or 100% UV protection, and actually wear them, especially in snow and bright glare. Respect the rules around your contacts. Never sleep in them, never swim in them. If you smoke, let this be one more reason among so many to quit. And if you're over 40, schedule an eye exam every 2 to 3 years, even if your vision feels perfect, because the diseases that steal your sight rarely announce themselves before it's too late. No one's going to sit you down and walk you through any of this in a 15-minute appointment, because there's no profit in keeping you healthy for free. I'll say it plainly because someone should. If this video gave you something worth remembering, hit that like button, subscribe, and help this channel reach 300,000 people who deserve honest answers about their health.